Hey everybody, Alex here, healthhacksreviewed.com. So continuing discussion here, I want to touch on, again, a little further here, some of the protocols that are possible with the LiVo2 system, altitude contrast. And so the goal with altitude contrast and what makes this equipment literally one of a kind on the market, literally no other brand or company doing anything like this, but this type of unique training for the body is the adaptive contrast system is when we're basically switching between oxygen-rich air and oxygen-deprived air. Okay, so literally we're going between something like 15% oxygen concentration, basically that's somewhere equivalent to an elevation of 14,000 feet. So I don't know if you've heard, sometimes like athletes or people will train at higher elevations, or just some of the studies that we've seen with individuals that have lived at higher elevations for periods of time. And there's different sorts of biomarkers and effects in their body versus people that are living at sea level. So it's basically switching between 15% and then an 80% oxygen concentration, be able to go between these two different modes back and forth, this sort of switch healing. With exercising, and it's high intensity exercise, is basically the key to driving oxygen deeper into the body, which is really what we're aiming for. So you might not know this, but these two things are exclusive, which is when the body is increasing circulation, okay, when there's a big boost in anywhere from the brain or anywhere else in the body, then we'll normally see a lowering of oxygen that basically the heart is putting out, okay, into your system, and vice versa. If our oxygen levels are raising significantly, then we will actually see a deficiency or a slowing down of circulation. Because the heart senses that there is enough oxygen present, and so it doesn't have to go on maximum circulation. And again, if it's saying, oh my God, I don't have enough oxygen, I better boost as much circulation as possible. Okay? And some of the most circulation you'll find is in the brain, because the brain is so sensitive, both temperature and oxygen levels, that especially up there, the body will do anything it can to make sure it's getting enough nutrients and oxygen and circulation. But so touching on both these different sorts of ways of training, there's a series of protocols that are possible with this type of equipment that really are suited for all kinds of individuals. Those who maybe want to lose a lot of weight, those who might have degenerative conditions that aren't in such a state that they can still do some exercise to actually be able to use the equipment, of course. But degenerative conditions, all kinds of different brain conditions, brain injuries, or TBIs. You've even rooted some forms of depression and things like that, emotional issues too. Fatigue, not producing enough ATP, enough oxygen. Okay, but it's again, my point being is that the things that this affects in the body really translate to all kinds of different health goals, all kinds of different conditions. Again, it's not just about athletes here. I consider this really equipment that is an amazing wellness protocol. Hyperbaric oxygen therapy, for example, amazing wellness piece of equipment. Ozone therapy, great piece of wellness equipment. Other types of therapies that just increase circulation just by itself, just that one facet. Any sort of heat therapy. So infrared, sauna. And then another type of device is called Avicen, which just uses normothermia and just heats up one area of the body. And there's other interesting studies like that going on overseas especially. But all those different types of things, this is unique from the standpoint that we're working with oxygen. We're boosting now the increase in circulation to maximum, and we're increasing the oxygen levels to maximum. Normally these two things are mutually exclusive. So we have protocols then that vary with the timing and all sorts of different variables in terms of how often you're sprinting, when you're using oxygen, when you're going into hypoxic modes, that are basically focused on specific sorts of goals. So maybe you were doing some exercise and you want to flush all the lactic acid out, flush all the toxins out of the cells and metabolic waste as fast as possible, reduce the inflammation as fast as possible, and that way your recovery time is twice as fast, or half the time really, which could be, anyways. That would be just one side, maybe that's for an athlete over here, right? Or maybe we have an individual with cognitive issues over on this side of the equation. We need kind of a specialized protocol for him. Or maybe we want to drop a few pounds of weight within a week by majorly boosting the metabolism. Again, there's a protocol for that too. So that's what I really appreciate about this. This form of training, this company, is that there's really well-established protocols for all kinds of different needs. And in terms of oxidative therapy equipment, and there are obviously other types of oxidative equipment out there, this is extremely unique because it's extremely efficient. 36 times as efficient, 30 times as efficient as some of these other methods in terms of how eventually it affects your physiology, some of these other sorts of approaches. All right, so I'll just briefly touch on some of the protocols out there, but there's respiratory protocols that basically help with the stimulation of new lung tissue, so you become more efficient, have a greater capacity. Increases blood oxygen transport capacity, so you build up a higher number of red blood cells. You may have heard of EPO doping. That's what they're trying to get at with the bicyclists, professional bicycling. But this actually does it naturally, especially with the hypoxic mode. That can also be replicated with high elevation altitude training and CVAC, CVAC. So that's a very expensive piece of equipment compared to this. Elevated red blood cell count, too, which is one of the effects of these various protocols, increase the circulating reserves, of course, of oxygen, which basically help to delay the aerobic to anaerobic energy production. And there's a lot of other very interesting, what would we say, just other types of optimizations and genetic expressions. The body goes into very unique modes of self-preservation and enhancement during altitude training, and which can basically be replicated with the reduction in hypoxic reduced oxygen training without having to go to obviously high elevations or using a very expensive CVAC machine. So protocols, there's a saturation protocol where you just saturate the body with oxygen when you're trying to reduce inflammation as a recovery mode after exercise. But also keep in mind, too, that protocol can be used because a lot of people suffer from systemic inflammation. Chronic pain is pretty much one of the biggest expenses for the medical healthcare system in the United States. I believe it's, what are the statistics? It's about like 8, I can't even remember. It's mind-boggling. What percentage, could be 80% or something, are on some kind of pain med for chronic pain, okay? And this can really get to the root of that, microcirculation issues, building up of too much lactic acid in one area or other metabolic wastes in those tissues, which then affect cell voltage potential that lead to the pain response. This really gets to the root of a lot of that, and the issue too is a lot of pain in the body or inflammation. You really find deep in tissues many times in the fine capillaries. So this is a way to really get deep down in there very, very efficiently. So people really see reductions in symptoms like fast, like after 15 minutes type of thing, which is the standard protocol. Especially if you're doing the hypoxic side of the equation, the high oxygen and the hypoxic. So we have clearing inflammation protocols, after exercise protocols, fatigue, chronic fatigue is common. A lot of people are just tired in general. They just don't have the same energy they feel like as they get older as they did when they were like, 15 or 16, right? Well, a lot of that has to do with many different things, but certainly a big part of it is not enough oxygen. And then when that happens, even if you have 1% less than ATP production, or just a 1% decline in the mitochondria, you'll have massive amounts of fatigue. So it really is that sensitive. Just a little bit reduction in some of these key elements can lead to that much ATP, just that small amount, and immediately you'll have all kinds of fatigue symptoms. So actually it's funny, the common complaint is, if we could say that I hear all the time from people that use this equipment, usually after a couple months or so, you just say, I have so much energy now, I literally don't know what to do with it. That's the big dilemma, that's the most common thing I hear, is I have so much energy now. I mean, so you have two options. You can go on more of a maintenance protocol where you're just exercising a few times a week for 15 minutes with it. So you can reduce the amount that you exercise, which is already short to begin with. Or you just find a new hobby or something to work on, some new project, or some other form of exercise as well, and get involved with sports. I mean, whatever it is, that's a nice problem to have, right? Especially as you get older. So there's a protocol for fatigue. And remember that fatigue can also happen a lot of people who exercise a lot or overtrain or just work really long hours, okay? With very repetitive types of things or very laborious jobs even. So it's not just the athletes. But basically, over-exercising or just overworking creates stress. Stress triggers capillary chokes, so it blocks the blood flow in capillaries and nutrient delivery. Capillary chokes then limit blood flow, which in turn increases reliance on anaerobic metabolism. Anaerobic metabolism increases the accumulation of lactic acid in the muscles and other tissues. Excess lactic acid limits blood flow loss in the anaerobic metabolism. Okay? So this sequence basically results in ever increasing fatigue and discomfort over time, because the body is never be able to create enough energy resources and recovery to undo all of that through that big sequence that I just led you through. So literally with the protocol, fatigue protocol, like you'll actually feel all those steps change in one session. You'll literally feel it. I have tons of even athletes who obviously know their body very well. They're just like kind of shocked after already overtraining, and then putting them on this, which is kind of like another form of training, and then them feeling actually infinitely better afterwards, feeling all the lactic acid flush out. Literally in this session, you could flush out the lactic acid, say, in your legs and feel it go out within like 1 to 2 minutes. It is that, or sometimes less. It is that fast, and it is that noticeable. You're burning, and then the burn is gone. So, anyways, I'll move on to the next protocol. So we also have brain oxygenation protocol. And I'll point this out, tinnitus, vertigo, brain fog, memory issues, ADD even, autistic sorts of things, Alzheimer's, dementia, concussive trauma, low blood pressure that's affecting the mind. All these sorts of different things are rooted in inflammation in the brain, eyes, ears, just all up here. Again, what's one of the best ways to knock out inflammation? Oxygen rich in electrons. Okay? Boom, just knocks it out that fast. Especially when we push the body hypoxically and then with a maximum then blood circulation and heart rate, and flood with a maximum amount of oxygen. It's that back and forth that is even more superior than just even standard purely oxidative exercise approaches, or just other types of oxidative equipment that only does that side of the equation, aerobic. So basically, with the brain too, we also saw in recent research that the brain is actually so crucial and has a direct link with the lymphatic system, the rest of the body, and the immune system. And the issue is a lot of people actually have something up with their brain that is going undiagnosed, that is affecting and creating their conditions. And you can only do so much in the body to heal, and a lot of times to take yourself to that next level, you really have to work on the brain. And a lot of health practitioners in general just don't have something strong enough, don't have enough good protocols or approaches to get more healing effects up here. So that's a huge plus right here. We need better protocols out there in general, better approaches to healing the brain or optimizing brain function. So we have a lot of information out in the field, people using this equipment for traumatic brain injury or just other sorts of mental decline. Again, that's a common thing I hear is the incredible mental focus that people feel like they have restored after just like a week or two. It literally is that fast, a few sessions that week. So there's an oxygen detox protocol. A lot of people are looking to pair this with infrared therapy, hyperthermia, when the body gets into a warmer state, which is already increasing circulation already. But everybody's really big on detoxification now, which you should be. And if you're a practitioner doing this, this is a way to supercharge that process. So there's a protocol for that. Oxygen detox protocol basically flushes metabolic waste out of the tissues rapidly in 15 minutes. It also then facilitates, by doing that, supersaturating all body tissues, plasma, lymph with very high levels of oxygen. It's basically the equivalent of spending many hours in a hyperbaric chamber, which a lot of people use also for detoxification, especially when the immune system is really worn down. So this boosts the immune system, but in a fraction of the time. Use a protocol like that if you're just sluggish, tired, or you're just overloaded. Honestly, everybody has to use it. Everybody is loaded with all kinds of stuff. So, and does it pair well with then sweating or sauna usage or other types of protocols where maybe you can more aggressively pull stuff out of the body, maybe with supplementation or just other strategies, but then support the body a lot with this protocol? Yes. It's just synergistic with absolutely everything. There's one protocol that you can use that's just for the immune boosting, where you pair it, as I mentioned before, with a hot tub, a hot bath, a sauna, anything to just basically raise your body temperature. So this is something that I do a lot because we end up, if you've ever gotten like sick after a lot of traveling or working in a very air-conditioned environment, or you're distressed from all the travel or exposure to cold or flu, all these sorts of stuff. There's a great protocol for that. And then the connective tissue, this is an important aspect to things. A lot of people have injuries in connective tissue or old chronic injuries, even that still give them problems. How do you really strengthen connective tissue besides obviously having a good diet and supplementing appropriately? And taking care of the body in other sorts of ways. But basically, sometimes exercising with chronic injuries can actually even make them worse. Just focusing on the muscular development, that can sometimes cause an imbalance between muscle and connective tissue. So basically, the connective tissue has to be able to handle repeated maximum repetitive tension, moving weights, or just repetitive movements even in general. You've heard about work-induced injuries where a person is just sitting at a desk. I mean, that's an example. It can even happen then over long periods of time. But basically, the muscles really being pulled, it's pulled out of balance. What's happening is actually there's a cumulative micro-trauma at those very fine tissue levels. Okay, so modern exercise methods basically don't recognize or address the factors that enable connective tissue development. So there's a protocol method in here with this equipment again that's basically focused on repairing connective tissue and developing muscle. Connective tissue receives oxygen and nutrients from what they call extracellular fluids. Okay, so that's fluid or solute outside the cells in the area. Okay, while muscle obtains nutrients and oxygen from the blood. Okay, so it's important to note the two distinctions there. Okay, so connective tissue growth is stimulated by shock, while muscle development is stimulated by just more of a smooth movement, strain or tension. Okay, so basically, when you supersaturate tissues with oxygen, okay, then what that allows the body to do is saturate literally into when they talk about dissolved oxygen and that rate that happens here with this type of training, we're basically saturating non-vascular body fluids with oxygen, okay? That's pretty magical stuff. I mean, seriously, when you really think about it. It's able to really get in there at a rate that, again, the blood is not getting there. So again, this is why some types of pain, chronic injuries, whatever you want to call it, can persist for so long, okay? The body is already trying to keep up with all these other demands, and you just don't literally are able to get enough physiologically into these non-vascularized tissues. And I would also point out that some chronic health diseases and conditions can suffer from the same things in some of these same areas, especially pathogenic organisms, because there's not enough of a blood supply. A lot of those immune factors, the immune system can't get in there and kill some of these tissues in the body. So this is a way also of strengthening those areas, as well as maximizing the amount of fine capillary blood flow to an area, which again can address some of these other types of diseases that have more pathogenic origins. So anyways, that's another protocol that I think is very good to touch on, because there's really not a lot of good stuff in general out there working with connective tissue injuries, past injuries, or current issues with it. But again, you know, you can very put two and two together here, that this sort of training is good for really all kinds of conditions. It really doesn't matter what it is. I recommend altitude contrast systems also, is an important note for individuals that are also quite old in age. So some of you might be thinking, well, you know, I'm an older individual, or I'm buying this for older clientele, whatever it is, 70, 80 years old, whatever. Obviously you still want to talk to your doctor first, but in general, if it's important that if a person is able to do kind of the high intensity exercise to make this protocol and the benefits, to realize the full benefits. But this is a reason that if you are older or working with older individuals, getting altitude contrast, because you can push the body and the heart circulation-wise, respiratory-wise, etc., going into hypoxic modes with a much more minimal amount of effort, okay? So if you actually went to a lower oxygen supply than normally what you're used to breathing, the body is just already going to say, whoa, like, I need to work harder here. I need to increase everything, including increasing efficiencies and optimizations. It's already going to notice that. And if you're just doing a little bit more push than just sitting and not doing any form of exercise or movement, just pushing yourself just a little bit in that hypoxic mode, you know, it depends on how much effort you're using, but at some point, whether it's 15 seconds or whether it's 2 minutes or 3 minutes, being in that oxygen deprived state will definitely put some strain on your body and will produce that response. And then at that point you would switch over to the oxygen, okay? So in other words, yeah, sometimes when somebody's very, very old or maybe has some sort of injury or something that's preventing them from doing really the true high intensity interval, you know, maximum output sort of thing, then again the hypoxic is even that much more valuable because you're going to be able to create that push on the body and that stress and strain with reduced oxygen much more quickly with less effort. Okay, so that's something that I think is very important to note. But also what that's also saying too is just efficiency-wise. Again, if you are able to intensely exercise and maybe you're younger, if you just want more efficient benefits than the standard oxygen EWAT system, again, you bring in the altitude contrast, you do the hypoxic, you work the anaerobic, and you work the aerobic, both sides of the equation. But do a little Googling around as well, just on the benefits of aerobic exercise, the benefits of hypoxic exercise, that's what it's called, our anaerobic pathways and aerobic pathways, really to be able to work both and leverage them both together against one another or with one another is truly innovative. It's truly a novel, unique training method, and I do a lot of research. I represent a lot of products. I consult on a lot of different equipment. There is literally nothing like this. There's nothing like this. actually, well, I would say there is one equipment that uses compression training, cold, and high intensity exercise, which produces definitely some similar results in a way, but does not kind of simulate oxygen deprivation as at higher altitudes. But my point of basically bringing up this other equipment, and if you're curious, I can tell you about it, but that equipment is extremely expensive. So comparatively, that's the other thing that we also, of course, factor in, is budget, right? And how much benefit and results can we get, for the least amount of dollars. At least that's the way I always look at it. So there's another type of thing out there that is very expensive, that does get good results. If you want to chat with me, you can about that. I chat about all sorts of different products that I have access to. Anyways, my website's healthhacksreviewed.com. You can reach me on my contact support page. You can reach me on my YouTube channel. Call me 7 days a week. My consultation is free, and be happy to discuss live O2 system, altitude contrast, oxygen multi-step therapy, and see if it might be right for you. Thanks for watching.